Hello, how are you? Did you know that some medications you take to treat other conditions can directly affect your blood sugar levels? This is especially dangerous for those with diabetes, as these medications can cause your blood glucose to spike, putting your health at risk. Just imagine, you're taking medication to control blood pressure, cholesterol, or even a simple cold medicine, and without realizing it, you're raising your blood sugar. What seemed like something simple could turn into a real nightmare for those already living with diabetes. These medications can have much more serious side effects than you might think. Some can even make your diabetes worse, making it harder to control blood sugar and increasing the risk of serious complications like heart problems, kidney damage, and even loss of vision. And the worst part is, you may not even know that these medications are affecting your health in this way. In this video, we're going to talk about 7 classes of medications that can directly impact the blood glucose of people with diabetes. They may be responsible for raising blood sugar levels dangerously without you realizing it. And what's even more frightening, many of these medications are common in everyday life for many people. So, if you have diabetes or know someone who does, it's essential to be aware of these medications. You won't want to be caught off guard, right? So stay with me until the end, as I'll show you exactly which medications they are and what you can do to protect yourself. Don't let poorly managed medications compromise your health. Before we dive into the first class of medications, make sure you're subscribed to the channel, because the next videos will feature a series of contents that will help you improve your health. First class: corticosteroids, hidden villains for blood sugar. Corticosteroids are amazing medications, true allies in fighting inflammation, allergies, asthma, and autoimmune diseases. But behind their fame as heroes, they have a side that can complicate things, especially for those who need to keep an eye on their blood sugar levels. Medications like prednisone and dexamethasone can significantly raise blood sugar levels, especially when taken orally or injected. To understand how this happens, it's important to know that corticosteroids mimic cortisol, a natural hormone produced by our adrenal glands. Cortisol kicks in during times of stress or inflammation, helping the body protect itself. However, when we use corticosteroids in treatments, they make the liver release more glucose into the bloodstream, as if the body were preparing for an emergency. And there's more. These medications also reduce the sensitivity of cells to insulin, making it harder for the sugar in your blood to be used efficiently. The result: elevated blood sugar levels, even in people without diabetes. If you have diabetes or a family history of the disease, using corticosteroids requires extra attention. These medications can make controlling glucose more difficult, so it's essential to regularly monitor blood sugar levels while you're on treatment. And don't think only those with diabetes need to worry. Even people with no diagnosis can feel the effects. High blood sugar can cause symptoms like excessive thirst, abnormal hunger, frequent urination, and constant fatigue. Sounds contradictory, right? So much sugar in the blood, but the body still feels lack of energy. But don't worry. This doesn't mean you should avoid corticosteroids altogether. They're essential in many treatments, and doctors know that. So always inform your doctor if you have diabetes or are at risk of developing it. That way, they can adjust the dose or even choose another medication if possible. Additionally, some simple actions can help minimize the impact of corticosteroids on blood sugar. Diet is key. During the use of these medications, opt for balanced meals, high in fiber and low in simple carbs, like refined sugar and white bread. These foods help keep blood sugar levels more stable. Another tip is to stay active. Light physical activities, like walking, can be allies in controlling blood sugar. Of course, always respect your body's limits and medical advice. If, despite these precautions, you notice symptoms like blurred vision, extreme fatigue, or nausea, seek medical help immediately. Blood sugar spikes can be dangerous and should be treated urgently. Corticosteroids, even though they can cause these side effects, continue to be vital in many treatments. With proper medical guidance and simple precautions, it's possible to enjoy the benefits they offer without harming your health. And you? Have you ever experienced a situation like this? Did you notice your blood sugar rising while using corticosteroids? Second class: beta blockers. Beta blockers are very common medications used to treat hypertension and heart problems, such as arrhythmias. Names like propranolol and atenolol have probably crossed your path in conversations or prescriptions. But did you know they can affect blood glucose levels? Yes, these medications, while essential for protecting the heart, can have an unexpected impact on blood sugar depending on the dosage and type. First, let's understand how beta blockers work. They reduce the heart rate and the force with which the heart pumps blood, helping to lower blood pressure and stabilize irregular heart rhythms. So far, so good. However, while they are doing this important job, they can end up interfering with another process: glucose release from the liver and the body's response to insulin. Beta blockers can cause two main problems related to glucose. The first is that they can make it harder to detect episodes of hypoglycemia, especially in people with diabetes. This is because these medications mask typical symptoms of low blood sugar, such as a rapid heart rate and shaking, leaving the person less alert to the problem. The second issue is that some beta blockers, especially older ones like propranolol, can reduce the cell's sensitivity to insulin, leading to increased blood glucose. If you already take beta blockers or know someone who uses these medications, you might be wondering, what can I do to avoid glucose problems? The first thing is not to panic. These medications are important and should only be adjusted or discontinued under medical guidance. However, there are strategies to minimize their impact on blood sugar. Healthy eating remains a great ally. Opt for meals rich in fiber, which help prevent sharp rises and drops in blood sugar. Also, maintain a regular exercise routine according to your condition. Movement is one of the best ways to help the body use glucose more efficiently. Another valuable tip is to monitor blood sugar levels frequently, especially when starting treatment with beta blockers or if the dose is increased. This applies to both people with diabetes and those who don't have it but notice changes in energy or other signs of uncontrolled blood sugar. If you have diabetes, talking to your doctor is essential. They can assess whether the beta blocker you're using is the best option for your case. Some newer types, like carvedilol, have a lesser impact on glucose levels and may be a better alternative. And, of course, pay attention to your body's signals. If you notice something unusual like extreme tiredness, blurred vision, or even mild symptoms you can't explain, don't hesitate to seek medical help. Small adjustments can make all the difference. Beta blockers, like corticosteroids, are proof that medications can be a double-edged sword. But with medical supervision, routine changes, and attention to detail, it's possible to use these allies to treat health problems without putting glucose levels at risk. Did you know about this side effect of beta blockers? Third class, statins. Statins are undoubtedly the champions of prescription medications when it comes to controlling cholesterol. If you've heard of simvastatin, rosuvastatin, or atorvastatin, then you're familiar with this class of drugs. They are extremely effective at reducing LDL, the famous bad cholesterol, and protecting against serious issues like heart attacks and strokes. However, despite their heart benefits, statins have a lesser-known side. They can interfere with blood glucose levels and even increase the risk of diabetes in predisposed individuals. First, it's important to understand how statins work. These medications block an enzyme in the liver responsible for producing cholesterol, reducing its concentration in the blood. This helps prevent plaque buildup in the arteries and keeps the cardiovascular system in good shape. However, during this process, some metabolic changes can occur, and one of them is the impact on blood sugar control. Statins can slightly increase glucose levels in some people, especially those already on the path to diabetes, in other words, pre-diabetics. Studies show that these drugs can decrease the sensitivity of cells to insulin, which makes it harder for glucose to enter them, resulting in more sugar remaining in the bloodstream. Additionally, statins can stimulate the liver to release more glucose, further exacerbating the problem. If you're thinking, should I stop taking statins? The answer is a resounding no. They are crucial for many people, especially those at high risk for cardiovascular diseases. The benefit of preventing a heart attack or stroke usually outweighs the potential moderate increase in blood glucose. But that doesn't mean we should ignore the impact statins have on blood sugar. On the contrary, it's important to know how to handle it. The first thing you can do is talk to your doctor. They can assess the type and dosage of the statin you're taking. Some, like rosuvastatin, seem to have less impact on glucose levels compared to others. The doctor can also consider your health history to balance the treatment. Additionally, lifestyle plays a big role. A balanced diet, rich in vegetables, whole grains, and lean proteins, helps keep blood sugar under control even while using statins. Regular physical exercise is also crucial, as it improves insulin sensitivity and helps the body use glucose more efficiently. For those who are already pre-diabetic or have diabetes, monitoring blood glucose levels is even more important. Medication or diet adjustments may be necessary to prevent blood sugar from rising too high. And remember, not everyone experiences this side effect. Many people use statins for years without noticing significant changes in their blood glucose. Despite everything, statins remain powerful allies in the fight against cardiovascular problems. The key is to find the right balance so that cholesterol treatment doesn't come with unwanted surprises in blood sugar. Now tell me, have you ever taken statins or know someone who uses them? Stay tuned to your body's signals, because in the next section, we'll continue exploring more medications that, despite being important, can influence glucose levels. After all, understanding how each one affects our body is the first step toward a healthier and more balanced life. Fourth class, niacin. Niacin is a B-complex vitamin, also known as vitamin B3, and plays an interesting role in our body. In addition to being found in foods like meat, fish, whole grains, and peanuts, niacin is used in high doses as a medication to help control cholesterol. It sounds like a natural and powerful solution, right? But, as with everything in life, there's a catch. Niacin can affect blood glucose levels. Let's start with the basics. Why would someone take niacin as a medication? This compound is especially useful for raising HDL, the good cholesterol, and lowering triglyceride levels, fats that can clog arteries and cause cardiovascular problems. Additionally, it has a modest effect on lowering LDL, the bad cholesterol. It seems like a complete package for those who need to adjust their lipid profile. However, when used in therapeutic doses, far beyond what we consume through our diet, niacin can interfere with blood sugar control. This happens because it impacts insulin metabolism. Niacin can reduce the sensitivity of cells to insulin, making it harder for them to absorb glucose from the blood. The result: blood sugar levels may rise, especially in people who are already battling prediabetes or diabetes. Another side effect to watch out for is its impact on the liver. In high doses, niacin can overload this organ, which plays a key role in sugar metabolism. This can lead to an increase in glucose production by the liver, further complicating blood sugar control. If you're considering taking niacin or are already using it, it's essential to talk to your doctor, especially if you have diabetes or are at risk of developing it. The doctor can assess whether the benefit for cholesterol outweighs the risks for blood sugar levels. In some cases, lower doses may be sufficient, or other cholesterol medications may be recommended. Now, if the doctor does recommend niacin, there are ways to minimize its impact on blood sugar. A balanced diet, low in simple carbohydrates and high in fiber, can help stabilize blood sugar levels. Regular physical activity is also a great ally, as it improves insulin sensitivity and reduces the risk of blood sugar spikes. And what about monitoring? That's something you can't neglect. If you're using niacin, keep a close eye on your glucose levels regularly. This helps identify any changes quickly and allows the doctor to make adjustments to your treatment if needed. Despite these cautions, it's important to remember that not everyone who takes niacin will have blood sugar problems. Each body reacts differently, and the key is consistent and personalized monitoring. So, what do you think about this information on niacin? It's a great ally in controlling cholesterol, but it needs to be used carefully, especially if you're already facing challenges with blood sugar control. Fifth class, antipsychotics. Antipsychotics, widely used to treat conditions such as schizophrenia, bipolar disorder, and even treatment-resistant depression, play an essential role in the mental health of many people. However, like almost all medications, they come with their complexities, especially when it comes to their impact on blood sugar. Let's understand together how these medications work and how they can affect blood glucose levels. First, it's important to know that antipsychotics work in the brain by balancing neurotransmitters like dopamine and serotonin. These imbalances are behind many symptoms of mental illnesses, such as delusions, hallucinations, mood swings, and extreme anxiety. Medications like olanzapine, risperidone, quetiapine, and clozapine help relieve these symptoms, improving the quality of life for those who use them. But the mental health benefits come at a cost. These medications can interfere with metabolism and increase blood glucose levels. This rise in glucose occurs through various mechanisms. One of them is the impact of antipsychotics on appetite, which often increases significantly. The combination of more hunger and less satiety can lead to weight gain, a factor already linked to insulin resistance. Additionally, some of these medications can directly alter how the body responds to insulin, making it harder for glucose to enter cells. The result: more sugar circulating in the blood. On the other hand, it's important to highlight something very important. Mental health has a direct impact on diabetes management. When the mind is out of balance, maintaining a healthy diet, following an exercise plan, and monitoring blood glucose can become a major challenge. In this sense, antipsychotics help stabilize emotions and behavior, making it easier to stick to a diabetes treatment plan and promoting a more balanced life. If you or someone you know needs to use these medications and is concerned about blood sugar, the best strategy is to combine mental and physical health into a single plan. To start, it's essential to talk to your doctor about the risks and benefits of the treatment. They can adjust the dose, choose an antipsychotic with a lower metabolic impact, or even recommend other medications to help control blood glucose levels. Additionally, there are practical steps that can minimize side effects. Keeping a diet high in fiber and low in refined carbohydrates is a great ally in blood glucose control. Regular physical activity also makes a huge difference, as it improves insulin sensitivity and helps control weight. And, of course, never forget to monitor blood glucose frequently, especially if you notice any changes in values after starting the antipsychotic medication. Although the increase in glucose is a significant side effect, we cannot ignore the positive impact these medications have on the lives of those dealing with mental health problems. Emotional stability is a crucial factor for success in managing diabetes and striving for a healthier and happier life. So, remember, it's all about balance and monitoring. Diabetes control and mental health go hand in hand, and with the right support, it's possible to find a path to a healthier and more harmonious routine. And now, are you ready to move on to the next class of medications that can influence blood glucose? Stay with me, the journey is just beginning. Sixth class, antibiotics. Antibiotics are silent heroes in the fight against infections, but like any medication, they can have side effects. A specific group, fluoroquinolones, can have an interesting, and sometimes concerning, impact on blood sugar, especially in people with diabetes or those predisposed to blood sugar fluctuations. Let's explore what this means together. Fluoroquinolones, such as ciprofloxacin, levofloxacin, and moxifloxacin, are widely used to treat severe infections, including pneumonia, urinary tract infections, and other bacterial conditions. These medications are effective, but their effect on blood sugar can be a surprise. Some people may experience blood sugar spikes, while others may face episodes of hypoglycemia or dangerously low glucose levels. The explanation for this lies in how fluoroquinolones interact with the body. Studies suggest that these antibiotics can interfere with insulin release by the pancreas. In some cases, this leads to an excessive release of insulin, causing hypoglycemia. In others, it may cause temporary insulin resistance, resulting in hyperglycemia. These reactions, although rare, can be concerning, especially in people who already have difficulty controlling their blood sugar levels. If you are using fluoroquinolones or any other antibiotics, monitoring your blood sugar becomes even more essential. During treatment, it's recommended to check your blood sugar levels more frequently than usual to quickly detect any abnormal variations. This is especially important if you notice symptoms such as dizziness, confusion, excessive hunger, or weakness, which may be signs of significant glucose fluctuations. Now, don't think that all antibiotics cause this type of effect. Most do not directly interfere with blood sugar levels. However, it's always good to be cautious, especially when it comes to powerful medications like fluoroquinolones. And if you're undergoing treatment and notice changes in your blood sugar, speak with your doctor. They may adjust the dosage, change the type of antibiotic, or recommend extra measures to help keep your blood sugar stable. An important tip: the use of antibiotics should be done responsibly. Never take them on your own and strictly follow medical guidelines. Poorly treated infections can cause serious complications, including blood sugar spikes due to the stress your body endures while fighting off invading microorganisms. Finally, remember that maintaining good hydration, a balanced diet, and a light exercise routine can help minimize the effects of medication on the body. And, of course, record any changes in your glucose levels and inform your doctor. Monitoring is key to safe and effective treatment. So, ready to continue this conversation? The next topic will bring more information on other medications that can influence blood sugar. Stay tuned, because knowledge is never too much when it comes to taking care of your health. Seventh class, cold decongestants. Cold decongestants are those medications we often turn to when we have a stuffy nose due to a cold or allergies. Many of these medications contain substances like pseudoephedrine or ephedrine, which help relieve nasal congestion. However, it's important to be aware that, for people with diabetes or blood sugar issues, these medications can have an unexpected effect. They can raise blood sugar levels. When we take decongestants, pseudoephedrine and ephedrine act as stimulants, helping to relieve congestion by constricting blood vessels in the nasal passages. This is great for clearing the nose, but these compounds can also affect the cardiovascular system by raising blood pressure and heart rate. What you might not know is that by doing this, they can also interfere with glucose metabolism, temporarily raising blood sugar levels. The mechanism behind this relates to the increase in the release of certain hormones in the body, such as adrenaline, which can cause insulin resistance and make it harder to control blood sugar. Pseudoephedrine and ephedrine stimulate the sympathetic nervous system, which can lead to an increase in blood sugar levels, especially in higher doses or in people with diabetes. If you use medications to control your blood sugar, it's important to be cautious when using decongestants containing these substances. If you need relief from congestion, opt for nasal versions or other treatments that do not involve substances that can affect blood sugar. If you need to take an oral decongestant with pseudoephedrine or ephedrine, try to monitor your blood sugar levels more frequently. This will help you quickly detect any increase in blood sugar levels and allow you to take necessary steps to correct any imbalance. If you notice a significant increase, talk to your doctor, who may suggest safer alternatives. In some cases, excessive use of these decongestants can not only affect blood sugar but also bring other health problems, such as increased blood pressure and a feeling of restlessness. Therefore, it's always a good idea to moderate use and follow medical recommendations. And remember, when you're feeling unwell and need a decongestant, don't self-medicate. Always seek medical guidance, especially if you have diabetes or other health issues. The professional can suggest alternatives that won't affect your blood sugar levels, ensuring you recover without compromising your health management. Tips for control. Controlling blood sugar isn't just about the medications we take, but also about how we manage our lifestyle as a whole. If you have diabetes or are concerned about your blood sugar, it's essential to adopt practices that help keep your blood sugar levels within the normal range. One of the key recommendations is always to talk to your doctor about the medications you're taking. Many drugs can have side effects that affect blood sugar, so it's important to ensure the treatment is adjusted to your specific case. One of the most effective ways to control blood sugar is through a balanced diet. Opting for a low-carb diet, rich in healthy fats, can be an excellent strategy. Simple carbohydrates, like those found in bread, pasta, and sweets, are quickly converted into sugar in the blood, which can cause blood sugar spikes. Instead, focus on foods like avocados, olive oil, nuts, walnuts, almonds, fish, and lean meats. These foods help control blood sugar levels without causing major fluctuations. In addition, regular physical activity is one of the pillars of blood sugar control. Exercises like walking, running, or even activities like yoga help improve insulin sensitivity, allowing the body to use glucose better. Even small changes in your activity level can have a big impact on how the body processes glucose. Another very important aspect is emotional control. Stress can directly affect blood sugar levels, so practicing relaxation techniques, meditation, or even taking time for enjoyable activities can help maintain balanced blood sugar. Remember, your emotions also have a direct influence on your physical health. Finally, never underestimate the importance of a good night's sleep. Proper rest plays a key role in hormonal balance, including the hormones that regulate blood sugar. Getting enough sleep helps keep the body functioning well and can prevent blood sugar levels from rising. Remember, controlling blood sugar is a daily task, and small actions can make a big difference in your well-being. Always talk to your doctor about medications and the best options for your case. Don't forget to take care of yourself and follow the recommendations for a healthy lifestyle. If you like this content, don't forget to subscribe to the channel and turn on notifications to receive more health and wellness tips. Take care of your health, pay attention to the signals from your body, and keep following our channel for more valuable information. See you next time.